Hello, and welcome to my rebuttal that complementary therapies are covered under the Canada Health Act. I have several objectives in this rebuttal statement. The first is to restate my resolution. Secondly, I'd like to rebut some of the points made by my opponent. Firstly, that regarding medical necessity and broad accessibility under the Canada Health Act. Secondly, the idea of risk, and I'm going to bring up informed consent. Thirdly, the lack of universality. And finally, I'd like to make a note about complementary therapy as a diversity, inclusion, and equity issue. To restate my resolution, under the current mandate of the Canada Health Act, the state of healthcare is at a nadir. The Act as it is executed does not sufficiently encompass the realities, necessities, financial strains, and diversities of a growing multicultural nation. The Canada Health Act must be reconsidered to reflect the challenges of current and future Canadians. Complementary therapies represent a wide range of therapeutic treatment options subject to provincial and federal regulations, such as the Regulated Health Professionals Acts or Natural Health Products Regulations. These therapies provide adjunct care to promote and restore the physical and mental well-being of Canadians. Given that many complementary therapies are regulated and provide effective health care treatment for Canadians, it is incumbent upon the policymakers to recognize their place in the Canada Health Act and remove the financial barriers which restrict access to care. Complementary therapies are covered under the Canada Health Act and should be included in insurable services provided. My first rebuttal point is in regards to the decision of what services are covered or determined on a provincial and territorial basis. But really, what is medical necessity? How is this determined? Think for a moment of a physiotherapist service that is offered in a hospital setting. This is deemed medically necessary to maintain health, and so it's covered. But those same services, which are offered in a multidisciplinary clinic, are now on a per-fee basis. Same service, just different location. One is covered, one is not. Also, consider for a moment, what if these physiotherapist appointments that are specifically designed for help a patient with knee osteoarthritis, well, what if at the end of their treatment of care, they no longer require a very costly knee replacement? Isn't that medically necessary? Doesn't that save the healthcare a lot of money? Knee replacement versus physiotherapy. Furthermore, my opponent notes that the CHA focuses on the provision of physician-directed care. Physicians routinely direct patients to complementary therapies. And this isn't just based on a whim. This is based on the recommendations of clinical practice guidelines for a panoply of conditions. We all know that access to primary health care providers is at a crisis. Canadians' access to conventional health care and medical providers is on a wane. We know that less and less Canadians have primary health care providers and less can access them regularly. Support for initiatives such as an interprofessional healthcare team is going to be necessary to meet the needs of Canadians moving forward in the future. And for Canadians without access to a physician, it is incumbent upon the CHA to improve access to complementary therapies to promote that optimal well-being and ease the burden on primary care providers. Secondly, my opponent mentions the aspect of risk with complementary therapy. Well, risk is a risk happens in treatments whether it is conventional or complementary care. We're all healthcare providers and we understand that a key tenet is informed consent. We must receive informed consent from our patient before we move on with a treatment plan. Well, we'd mention risk. We talk about risk. The provider must disclose to the patient the gravity of what the treatment is going to be and any risks related to the treatment in question. These risks might be minor side effects, but they could be serious as paralysis or death. Another tenet of informed consent is that the patient should be informed about alternative forms of treatment. This could mean the complementary therapies. Much like in my earlier example, a patient who could be consulting for a knee replacement surgery may be given the option of an alternative therapy such as knee physiotherapy. Consider for a moment too risks. Well, the risk of a massage therapy treatment is bruising. A risk of an opioid prescription could be pharmaceutical dependency. However, both massage therapy and opioids are included in the clinical practice guidelines for low back pain. Which risk seems more deleterious for a patient's overall well-being? Complementary therapies have risks. So do conventional therapies. We do not proceed with either until we've received our informed consent. And do we not do either treatments just because of the risk? Or do we make an informed decision that will best promote clinical health, optimal health for Canadians? Safeguards for public health do exist under provincial and territory regulatory bodies. In the province of Ontario, if you believe your doctor has been unprofessional, you can file a complaint with the College of Physicians and Surgeons of Ontario. If you believe your naturopath acted unprofessionally, you can also complain to the College of Naturopaths of Ontario. Both regulatory bodies may offer discipline, undertakings, or may choose to revoke the healthcare provider from practice. It is the same procedure and the same safeguard for both professions. They're both under the RHPA. One is covered under the Canada Health Act, one is not. This is not all complementary therapies are regulated, and frankly, nor should they be. However, those that are evidence-based, clinically indicated, cost-effective, and with a regulated public safeguard should be codified in law, should be equally available to Canadians under the umbrella of the Canada Health Act. My opponent noted the lack of universality when it comes to many complementary therapies, and many complementary therapies are already regulated under provincial and territorial healthcare acts, which this provides safety for healthcare consumers, as I mentioned in the earlier slide. As I mentioned in my opening remarks, something like chiropractic is already regulated in all of the provinces in one territory. When these providers go to school, it's often at a graduate level, and many of the educational curriculum is subject to Canada-wide accreditation standards. This ensures continuity of care education to these clinical providers across national boundaries. My opponent suggests that the lack of universality across complementary therapies make it challenging for its inclusion under the CHA. I agree. Indeed, the wholesale adoption of all therapies under the CHA is illogical. Many lack regulation or substantive evidence to warrant their inclusion. However, as noted above, many complementary therapies are adopting national standards to promote universality of care across Canada. For example, the Canadian Chiropractic Association, the Canadian Massage Therapy Association, the Canadian Association of Naturopathic Doctors, the Canadian Association of Traditional Chinese Medicine. These are just a few complementary therapy Canadian national organizations which are working to a greater universality across our nation. Finally, Canada, as we know, is a multicultural nation. Multicultural is a sociological fact of Canadian life. In the 2016 census, there were more than 250 different origins and ancestries in Canadians' population. There is a discord between the viewpoint of medical services. She noted herself that TCM would be considered complementary in a Canadian context, but would be considered part of the conventional care in non-Western countries. So why are we excluding care of someone's national heritage? The multicultural heritage of Canadians was canonized in the Canadian Charter of Rights and Freedoms in 1982. The Charter should be interpreted in a manner consistent with the preservation and enhancement of the multicultural heritage of Canadians. The rights and traditions of all cultures are firmly rooted in the wider framework of Canadian society. Also, culturally appropriate communication between healthcare providers and patients is a cornerstone of patient-centered care. When we include complementary therapy, which is traditional and patient-centric, this supports healthcare practice which encompasses race, ethnicity, and cultural diversity. Patient-centered care must embrace a wide variety of beliefs, values, and customs. So to fully support the Canadian population and uphold the spirit of the CHA, healthcare options in Canada must reflect the cultural competency and be as diverse and multifaceted as the demographics of the community. Canada's net migration rate is the 8th highest in the world. This means that Canada is going to continue to be a more and more diverse nation. We are going to continue to welcome new Canadians from around the globe, and in doing so, we are going to welcome their healthcare traditions. And our healthcare system needs to adapt and expand to include complementary therapies. So in conclusion, my opponent made some excellent points about what should be included in the CHA, including medical necessity, risk, and universality. I counter that much of what she proposed is true. Not all complementary therapies are suitable for inclusion. However, many CTs are medically indicated through the inclusion in CPGs and are regularly recommended by physicians. The risk of CT is not necessarily greater than that of conventional medical treatments, and regulated professionals do obtain informed consent outlining such risks prior to practice. Complementary therapies are moving towards national coherence and greater regulation. Finally, the lack of inclusion in the CHA of traditional complementary therapies is culturally inappropriate in our multicultural society, where Canadians should be granted the freedom of healthcare choice, unhindered by financial barriers. Thank you for taking the time to consider my rebuttal, and I look forward to our discussion that will begin soon.